Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning, everyone, and once again, welcome to CATHIP's Health Hour. Welcome to our regular listeners, and I'm also welcoming those who are spending time with us for the first time. My name is Dr. Vanessa Abiye. I'm a consultant in sexual health and HIV, and I'm your host for today. So first of all, what is CATHIP? CATHIP is the Caribbean and African Targeted Health Improvement Program. And really, it's a collaborative, it brings together education and supports empowerment and health literacy to make sure it reaches people, so it enables them to take control of their health and to support others. And this partnership includes many organizations: CARN, the Caribbean and African Health Network, the Black Health Initiative, the Royal Assembly Redeemed Christian Church of God, RAFA International Development Agency, Croydon BME Forum, and the Enfield Caribbean Association. And as always, we have topics of health relevance for you, for your partners, for your family, your friends, and all your network. And the key thing is, again, is that it is for you. So we're here, we're bringing great people from the medical profession, from other parts of the health profession here for you, Black people that are here to educate you. But you must feel free to ask any questions that you have, comment in the chat. Feel free afterwards. You'll have an opportunity to ask questions directly. We really want to hear from you, and we want these health hours to really meet your needs. And as we've got the chat there, it would be great to hear about where you are, who you're with. Is it just you, or are you with friends and family, so that we can all kind of feel like a network and family together. Just another bit of housekeeping to remind you that we are recording. So if you prefer not to show your face, that's fine. When you want to ask a question at the end, you can choose not to have your camera on, but it would be great to hear your voice. Every time I host, I always say it is a huge privilege to hear from another colleague in another part of the UK to share their experiences. And today I'm really honored to introduce Dr. Hector-Goma. who is a GP and senior partner. And he's going to be talking on a topic that I love, and I love the title, Man's Not Hot. And it's really a call out, a call to action for men, an overview of men's health and kind of the early signs and the warning signs of ill health. So if you're here alone and you're a guy, you're very welcome. If you're not a guy, please call all the guys in your family to come and listen, because I know that today is going to be a great session. So over to you, Dr. Hector-Goma.
Thank you very much, Vanessa. It's an honor and a privilege to be invited again by Khan to talk today on the topic, Man's Not Hot. Just a quick review of the slides. Man's not hot. So I'm a GP, as Vanessa said, based in Leeds, Allerton and Westfield Medical Centers. So our focus for today's talk, we'll have a quick overview of healthy living, and we'll look at health literacy and navigating care in the UK. And we'll look at screening opportunities for Black men. Then we'll dive into the early warning signs of ill health. And then we'll end with the reality that the NHS that we all love so much is on its knees and what we can do about it. I'd like to start with a tribute to Heather Nelson, who is well known to the Khan family and to many of us. She was the Chief Executive Officer at Black Health Initiative in Leeds. And if you look at the 11 o'clock position of my slides, you could see that on the 11th of June last year, she was here with me. I had the opportunity to talk about prostate cancer, and she was here with me. Unfortunately, she's left us. She's gone to the unknown, the great unknown, and then we just pray for our family to be comforted and for the rest of us to carry on while we are here on Earth. So I'd like you to take a screenshot, if you can, of this slide. It's what I consider a traffic light self-audit on lifestyle. So if you can take a screenshot of this slide, and we'll come back to it towards the end. It's like you giving yourself a score, a traffic light score, whether red, amber, or green, in these 10 lifestyle areas of diet, physical activity, sleep, social networks, weight management, alcohol intake, smoking, happiness, helping others, and enjoying work if you are in employment. So we'll come back to it towards the end. Now, these are habits today which would help to keep 999 away in your latter years. Sometimes I see patients in clinic, and maybe a 40-year-old who says, I don't come to the doctors often. And I just say, well, in a nice way, say this in 30 years' time or in 40 years' time, then I'll say you're making a point. At age 30 or age 40, you don't have much reason to come to the doctors. So these are habits, the air you breathe, which depends on where you live, the food you eat, your level of physical activity, whether you smoke or not, whether you drink or not, how much sleep you get every day. These are some of the habits today which can keep 999, the ambulance, away in latter years. And where we live also has a massive impact, like I mentioned, air pollution, noise pollution, decreased exposure to sunlight, particularly people that live in high-rise, highly dense areas, light pollution, dense population amongst migrant people, as well as the microbes that we're exposed to. So this, where we live, has a massive impact. Everywhere in the world, the poor are more likely to be sick, and the poor die because they live in environments that are less favorable to health. Now, health literacy is the ability to understand, make sense of, and act on health information. So we're going to share a bit of health information in the next 30 minutes or so. And I've underlined this act on because there's no point hearing health information if at the end of the day you do nothing about it. But if you hear something that you find useful and you act on it, then that is health literacy. And sadly, it is said that about 43% of adults in England find health information too complex. I hope that what we have here is 57% of those who are able to act on the health information that you receive today. Now, there are 2 slides on care navigation. It's really important for us to have the knowledge and have the confidence and the ability to go to the right place. We talk about the right person, right place, right time all the time. There are some conditions such as indigestion. We have the basic aches and pains, maybe diarrhea that started last night or constipation a few days. Such things, you don't need to go to your GP. You can have self-care. Maybe you had diarrhea, you ate something dodgy yesterday, you have diarrhea, and go to the chemist and say, can I have a packet of Imodium or loperamide? You have diarrhea, something like that. Or it will pass. Just drink fluids, rest, and then see how it goes. So some things you can self-care. You know what you need to see your GP for. If you have toothache or swelling in the mouth or bleeding gums, that's a dental problem. You don't need to go to your doctors when you have toothache. You know, if you don't have a dentist, then you try and find a way to access a dental service in your city for those who don't have dentists. If it's an eye issue, the optometrist, there's a lot of information online. We'll talk about that again as time goes on. If you have mental well-being concerns, there's a whole range of support services online and face-to-face in your community. If you have minor cuts or burns or minor injuries, it's a minor injuries unit. And of course, if it's a sudden chest pain, which is not going away, symptoms of stroke, shortness of breath, acutely bleeding, that's 999, blue lights, you go to the hospital. And that's the first level of care navigation, knowing who to go, who to call, or where to go, depending on the kind of symptoms that you have. The next slide talks about if you now decide to call your GP, when you call us, the first point of call, if you do pick up the phone, is the receptionist. What we, in my practice, we no longer call them receptionists. They are patient support team. They are in a position, in some places they call them care navigators. They have been trained to signpost you to the part of the practice or even the part of the NHS that would be best positioned to give you support. So if you call my practice, for example, and your problem is hip pain or joint pain, they probably book you in to see the physiotherapists who are professionals who know exactly what to do with joint problems. If they see you and they think this is something else which is more sinister, they will book you in with the GP. If it's about medication, you need some acute prescription or your repeat prescription is overdue, you need to have it sorted, they'll book you in with the clinical pharmacist, not the GP. They are the role of the nurse practitioners and so on. So the healthcare assistant sees patients that have long-term conditions and does the first review before the GP or the nurse sees you. So please trust the care navigators. Yes, some of them are under a lot of pressure and they come across you as being blockers, but they are not blockers. They want to be sure that you see the right person the first time. So that's the second thing I would like to talk about. Care navigation within primary care. Don't see receptionists or care navigators. Don't see them as blockers. They help to navigate you to the right person. We'll go into health screening for the Black man in the NHS. The first screening, which is for everybody, Black man, Black woman, everybody in the UK, when you turn 40, you are invited to your NHS health check. Now, if you're here listening, watching, you are 40 years and over, you've never had a health check, please call your practice or send your practice an email and tell them that you are over 40, you've not had a health check. It might be that they had invited you, but you didn't attend. Please get in touch with your practice and have your NHS health check. Now, if you don't have any long-term condition, you are going to be invited for an NHS health check every 5 years. So from age 40, age 45, age 50, until if you have a long-term condition, then you no longer require health check. You have an annual review of that long-term condition. Now, as a Black man, I've put age 45 here. This is not a service that is currently given by the NHS, but because prostate cancer is commoner amongst us as men of African descent, by the time you get to age 45, you have a right to request a PSA from your doctors. Now, the PSA, the prostate-specific antigen blood test, is not specific for prostate cancer, but at least that's what we have now. And it can give you a baseline so that even if you don't have symptoms, you're a Black man, you're 45 and over, request a PSA. If it is normal, fantastic, you have a baseline. If in future you have symptoms and the test is done again, your doctors have a baseline PSA to compare with. So again, if you've never had a PSA test, you're 45 and over, please request a PSA. Now, sometimes some GPs may not honor your request. If you go to prostate charity website, there's a section that tells you how to deal with that. There are template letters that you can write and send back to your doctors. And when you do that, they will have no choice but to grant your request. So a Black man, 45 and over, if you've not had a PSA test before, please request it. It's in your best interest. And then the next screening that you'll be invited to is at age 60, when you have an invitation to bowel cancer screening. We'll talk about that in just a minute. So the NHS health check is exceptionally important. I like the phrase, a stitch in time saves 9. The NHS health check will check your HbA1c, which is a blood test for diabetes. So if your blood test, your HbA1c is high, they would go on the pathway for diabetes diagnosis. If it is above normal, but not yet as high as diabetes, you are then in a phase called pre-diabetes, and there's a support system to prevent you from becoming diabetic. It's all lifestyle advice to try and shift the numbers to the left, where you go from pre-diabetes to normal blood sugar levels and preventing you from going from pre-diabetes to diabetes. If you don't have a health check, you may not know this, because in the initial state of diabetes, there are no symptoms at all. Likewise, the health check would help to prevent heart disease. It would check your blood pressure. It would check your cholesterol. These high blood pressure and high cholesterol over time can lead to heart disease. So by having your NHS health check, your blood pressure level is known, your cholesterol level is known, you're given advice on what to do, again, to have a left shift. Next one is kidney disease. Initial times, there will be no symptoms. Many of us as Black people end up having kidney problems and chronic kidney disease and kidney failure because we have high blood pressure, which again has no symptoms initially. We have diabetes, again has no symptoms initially. So hypertension and diabetes ultimately damage the kidneys, leading to kidney disease. So having your NHS health check will help to see what your kidney functions are like and help to give advice. Likewise, stroke and dementia. Again, high blood pressure, high blood sugar, high cholesterol ultimately can lead to stroke and dementia. A stitch in time saves 9. NHS health check is what every one of us need to do to kind of keep ourselves healthy and well. So at the bottom, you can see 40 plus 5 is 45. 45 plus 5 is 50. I wish I could just do a rhyme on that. So 50, 55, 60, 65, 70. You have the right on the NHS to do a 5-yearly health check if you don't have any long-term condition. Bowel screening, you can see at the bottom of the page, I got my first letter. It gives you an idea of how old I am now. I got my first letter and it says, I'm inviting you for NHS bowel cancer screening. And I circled this. Screening aims to find bowel cancer early. I mean, a stitch in time saves 9. It's just to do a pool sample, take a tiny bit of it on this device, just these 2 bits there, put it back in the container and post it back. And that could very well save your life. And from the first one, you get invited every 2 years. It starts from age 60, but they're trying to bring the age forward. So in some places from age 54, some from age 56 or 58. But definitely if you're 60, you've not had a bowel cancer screening, you must do something about it. And if you're 58, check with your doctors whether your time has come or not. But please do your bowel screening. If it's found early, it will save your life. And this is your call. There are a few other things that are not on screening, but there are things that you need to do. One is the actual prostate. If you write these things down or take a screenshot, IPSS score, there are 7 questions. Each question has 5 marks. And your score of those 7 questions will give an idea on how your prostate is functioning. So even if you don't know, just Google IPSS score and just see what your scores are. If your score is moderate or high, it means you need to see your doctors and have a conversation. The next one is, feeling tired or sleepy during the day. Some of us were watching TV, we fall asleep, we're driving, there's a red light, we nod off. That's a kind of warning sign that you may have obstructive sleep apnea, which causes you to keep waking up in your sleep without actually waking up, and your brain is tired. And again, if you Google Epworth sleepiness scale, it will give you an idea. If your score is high, please make an appointment with your doctor. Erectile dysfunction, we've talked about here before previously. Again, if you Google IIEF score to give you an idea on how your performance is, I'm sure you know exactly how it is, but this will give you an objective score on if you're able to keep it up for long enough. Then if your get up and go has got up and gone, that suggests that you may have a depressed mood, or if you feel very anxious. Again, you can check PHQ-9 and GAD-7. These are scores that will give you an idea in the UK about anxiety and depression. Again, if your scores are moderate to high, there are self-help strategies, or you need to kind of see your doctors or the mental well-being support person in your practice. And for the older people, where you begin to get concerned about memory, or you are concerned about your father's memory or your mother's memory, 6CIT, again, you can Google it. It's one of the early tests that we do. You can do it at home. And then if it's your score, or somebody will have to administer, if the scores are high, over 7, then it makes a good reason to book an appointment with your doctors. Now, another one is man's not hot. Normally, you can see the testes here. Looking at the anatomy, the testes are the white structures here. They are smooth. There's no other lump on them. Above the testes, you have the epididymis, so when you feel above it, you feel something different. But on the testes themselves, there is nothing else. If you feel anything else on this around here, if you feel the testes, that's unusual. You need to have it checked. So an unusual lump or swelling, sharp pain in the testicle or scrotum, a heavy scrotum, an increase in the firmness or the feel of the scrotum, an unusual difference. One is always bigger than the other. The hands, the feet, the breast, the testes, the same thing, but an unusual difference in the size between one testicle and the other. Please have it checked. Just reminds me of this good story that what is more painful, a man being hit in the testes or a woman having a baby? Well, a woman who's had a baby, maybe she didn't have an epidural, a vaginal delivery, it's very painful, we are told. But after 1 or 2 years, she could tell her husband, I think, let's have another baby. But there's no man who's been kicked in the testicles who ever ask to be kicked in the testicles again. So for that reason, we all agree that a man being kicked in the testicles or having severe sharp pain there is more painful than a woman having a baby. We all agree on that. So let's go on to looking at the common symptoms. And on the left of the slide, there are 3 websites that I will recommend. The first one is Self-Care Forum. Self-Care Forum helps to support us with self-care, looking after ourselves. And on their website, there are about 35 fact sheets on various conditions, which I recommend, about health literacy. For example, 95% of back pain is self-limiting. 95% of back pain might take up to 6 weeks. 95% of back pain is self-limiting, and many people consult their GPs because of back pain. Now, if you know what the red flag symptoms are, it will help you to know when to contact your GP for back pain, for example. Another website is patient.info. It has excellent information about common symptoms that patients have. A lot of us go to Dr. Google and we learn a lot of things on Google and come to our doctors. But if you go to trusted websites to get information on any symptoms, that would be useful. And then the next one is NHS own website, NHS Health A to Z. Again, any symptom that you can think about, you can go to any of these three websites and get evidence-based information. So a common symptom, I'll just quickly go through these symptoms. I won't take too long because of time. But headache is a common symptom. Again, we have headaches, you go a night out, the next morning you may have headache, you may have infection of the sinuses and maybe headache, but a headache may also be a sign of something more serious. I have the personal example about 2 months ago. I had what I thought was sinus problem on my maxillary sinus. It was there for about a week. I thought it was viral. After 5 days, I had severe pain. I just couldn't sleep for 2 nights. And I just said this after 2 nights of not sleeping well, I said, let me just check my blood pressure. And it was through the roof. I had to call an ambulance. Now, if it was not for that headache, which was this facial pain, which was unbearable, I wouldn't have had a need to check my blood pressure. But when I did, it was sky high. And that's why sometimes headache can be something serious, but many times it's not serious. Your mood, I talked about it already. If you broke up with your partner or you had a quarrel with your partner, it might make you feel low. But if you have mood which is either high or low for more than 2 weeks, then you need to kind of get checked out. Doing your PHQ-9 or GAT-7 is something that is worth doing just to see where things are. Memory problems, particularly in older people. If you feel your memory is going and then versus if people around you feel your memory is going, then having your 6CIT done or having a checkout is important. Every one of us needs to have an eye check every 2 years unless we have eye conditions. If you don't have an eye check in the last 2 years, please book one. An eye check is a mirror into your health. Sometimes an eye check will lead to you being advised to go and check your cholesterol or go and check your blood sugar levels or go and check your blood pressure. Having your eye check every 2 years, if you don't have any condition, is important. Things like glaucoma, cataract are picked up when you have an eye check done. Snoring is a fairly common problem. I already talked about the Epworth sleepiness scale, something to check because sleeping and snoring can lead to weight gain, contribute to diabetes, high blood pressure. Of course, the main issue about sleeping on the wheel is a no-no. And those are the kind of things that just snoring alone is worth checking things out. When was the last time you had a look in your ears? Seeing an audiologist too. I mean, the same way you have an eye check and go to any of the high street places and have a hearing check. Dental check is every 6 months. Do you have a dentist? Having your dental health can be a reflection of your general health. Going down to the voice, lump in the neck, difficulty swallowing, if it lasted for 3 weeks, is something that you must have it checked. Again, if your voice is hoarse after going out to O2 Arena for one of those concerts, that's fine. But if you have hoarseness of the voice that has lasted for 3 weeks or more, anything that lasts for more than 3 weeks continuously, please have it checked. Bone pain, lump on the chest, again, persistent cough, which has lasted for more than 3 weeks, please have it checked. Blood, if you cough out blood, that's something that you don't need to wait. You need to kind of get an appointment with your doctors and have it checked. If you take a deep breath and it catches, if you feel pain, sometimes it's just a viral infection, and maybe again between 1 or 2 weeks it will subside. But if you're a woman who is on the pill and you have that kind of pain, it might be a blood clot. If you're on the combined pill, so that kind of pain, don't ignore it. Don't wait for 3 weeks. Chest pain which lasts for more than 20 minutes, more so if you're over 40. Those are things that you need to have checked out. Shortness of breath, again, which comes with chest pain, have it checked out. So it's a bit of a difficult one. It may be nothing, it may be something. For some conditions, it's good to just do self-care, wait for 1 to 3 weeks if it's a viral infection. But the rule of thumb, anything that has lasted for over 3 weeks, you must have it checked. But for things like chest pain, It's lasted for 20 minutes. It's not getting any better. It's a 999. Well, a few more symptoms. Any pain, blood, there are things, black poo, if you're 40 and over, weight loss, loss of appetite, combined with some of these other symptoms. There are things that you need to get checked. But like I said, self-care forum, patient.info, NHS Health A to Z, you can kind of read about this. And if you are still uncertain, please try and book an appointment with your doctors. For the older men, pain, blood in the urine, you must get seen right away. Any blood in the urine, please don't wait. You need to get seen. Things about loose stool, constipation might be due to irritable bowel. But just rule of thumb, check it out. But any blood, please don't waste time. But other symptoms, you can practice self-care first, see how things go. If you have loose motion for more than 2 weeks continuously, constipation for more than 2 weeks continuously, then it's a good reason to go and have it checked. The root cause of most of the problems is plaque formation in the artery wall. So here we have a nice smooth blood vessel. Nothing is clean. Blood flows very well. Now you can see plaque buildup, which comes from bad cholesterol. It builds up in the walls of the blood vessels. The blood vessel becomes narrow, and it goes on and gets to a point where it's entirely blocked. If the blood vessel is blocked, blood doesn't flow. The cells, the tissues, the organs are starved of oxygen and nutrients, and then they die. This is where it happens when you have a stroke or a heart attack. Is because of blood supply not getting to those structures of the body. And that is the root cause. The next slide will show us what's going on. So things like smoking, alcohol beyond moderation, junking, lack of funds to make healthy decisions about what you eat will now lead to clogged arteries. And as this shows, when there's a buildup of plaque, blood doesn't flow through, and distally there is starvation of the cells. And this can affect the various organs of the body. This is where screening and taking a note of the early warning signs. So for example, erectile dysfunction may be a sign that blood is not flowing well to the penis, and taking action there and having it checked out may lead to preventing a heart attack in the next couple of days or next couple of years. So erectile dysfunction may be a sign of impending heart problems or even impending stroke, or kidney damage. So getting to see your doctors and talking about it may lead you to know that your cholesterol is high, your blood pressure is high, your lifestyle needs to improve. And when you make those changes, you will be saving your life. Now, this is a story that I read 5 days ago on Twitter, or X as it's called. I had a scan to see whether I had ovarian cancer in July. The results came back in September, confirming my worst nightmare. I waited in A&E for 36 hours last week because I lost the ability to walk. I had an MRI head today to check whether the cancer has spread to my brain. I really hope I won't have to wait 2 months to find out. Now, this is really sad. This is a doctor sharing our experience on Twitter. The NHS is on its knees, and you really have every reason to take charge of your health. It might take weeks to see your GP these days. In the next year, 2 years, God knows how long it would take to see your GP. It's taking months to get to see a hospital consultant. In the next few years, it may take a year to see a consultant. So do whatever you can to practice healthy lifestyle and look after your health. So the spectrum of health is that at the base of the pyramid, we have people who have very low risk. They are well, maybe just minor ailments, occasional cough, catarrh, occasional tummy ache, indigestion symptoms, otherwise they're fine. Then those with low risk, maybe they have one long-term condition, diabetes or hypertension, nothing else. Those that have multiple, maybe has heart disease, has diabetes, multiple long-term conditions. And then those that who are frail, have complex problems, and they have high risk. And then those that have very high risk, people like in intensive care, those that have come out of major trauma, and people who are feeling suicidal, those are kind of very high risk. So that's a spectrum of health. And if you have very low risk, it's really important that you do your best to If every one of us needs to look after himself, but you have every reason to look after yourself. So the self-care continuum is like everyone, whatever your level of risk is, you need to have a way to look after yourself. And even those that have long-term conditions, they spend 30 minutes with a nurse, but they spend the rest of 6 months with themselves. So it's really important for us to have a continuum of health, of self-care. So we'll come to Man's Not Hot. I'm sure many of us know this song. I think I listened to it. I watched it about four years ago. And in this scene in the video, that's the young man wearing this lovely jacket, and his partner tells him, "Take off your jacket," and he replied, "Man's not hot." Of course, he has. I was reading about it. You know, sometimes those of us who live in London and areas where knife crime it's a big issue, some men wear this kind of clothes to protect themselves in case somebody tries to stab them. So it might be a question of protection. So the weather will be very hot, but man's not hot. So the paradigm shift is that, yes, you may have a reason to wear this kind of thick jackets when the weather is hot, but the point is that we all need to look after ourselves. There's a long wait everywhere, a long wait to see the GP, a long wait for a consultant appointment, a long wait for surgery if you need surgery, a long wait for rehab. So please look after yourself. It's not enough to say man's not hot. Man is hot, and man needs to take off his jacket and look after himself. Healthy lifestyle is the key more than ever. Before, you could just do whatever you like, knowing your doctors will fix you, but not anymore. Practice self-care. Manage minor ailments with the help of your community pharmacist. Embrace care navigation and save GP appointments. I have older, frail patients who cannot get to see me because people that have minor aches and pains, lumps and bumps are complaining, I'm must see my GP and all of that. If you embrace care navigation, then we can make the few appointments available to those who need them most. Health screening saves lives. I know quite a few people who had no symptom whatsoever. They sent off their poo sample, blood was found, and then they had a colonoscopy. They found a cancer, which was very early in the colon. They removed it and they lived long thereafter. If they didn't do that health screening, that bowel screening, they would have not known until you have had an advanced colon cancer. Same thing goes with just having your blood pressure check. Might let you to know that you're hypertensive and you never have known. Hypertension is a silent killer. You know, so health screening saves lives. Ignore at your peril. And if you got the resources, get private health insurance. I told my daughter, who is 22, started doing some part-time work, doing a master's. I said, if you can, get private health insurance, because in the next 10, 20 years, it might be that there'll be no NHS the way we know it today. So if you've got the funds, if you can afford it, please practice health and private health insurance. So let's come back. So I have just 2 more slides, I think. Let's come back to the traffic light self-audit. Where have you scored yourself on diet? So if you just kind of have a quick go at this, I would say out of the 10, anywhere that you've ticked a red, it means that you have a reason to do something about that as soon as possible, if not sooner. Where you have a green, then it's a thumbs up, keep up the healthy lifestyle. Where you have an amber, it means there's something to do. But if you've ticked red anywhere, that's one that you need to do something about. As I'm talking, I'm looking at number 3. Number 3 is looking at me. I have a red in number 3, so I need to work harder on that. So I'll finish by saying, have a Merry Christmas and a Happy New Year in advance. I have a video that I would like to show if time is far gone. So I'll just say Merry Christmas and Happy New Year in advance, and back to the facilitator for the day.
Dr. Hector-Goma, thank you so much. What a fantastic overview, and lots of really relevant advice, but also practical advice as well, which people can take on in terms of advocating for themselves and for self-care. So we've got questions coming in, as always, some in the chat, some privately. But as ever, as I said earlier, for those listening, this show is for you. So if you have any questions, please do put them in the chat. We've got about 25 minutes to really grill Dr. Hector-Goma. We've got him with us, so we're going to take full use of him. But also, it's just an opportunity for us to share with each other. So if you'd like to ask a question, either in the chat or do put your hand up with the reactions button within Zoom, and then we'll be keeping an eye on that. So I love, there's loads of questions as ever, so it's all great. So one of the things, just for clarification, was someone saying, what's the full meaning of PSC? And I think they mean PSA.
Yes,
Yeah.
PSA.
And if it isn't PSC, whoever read the question, please let us know.
Yeah, PSC, I think, is Police Service Commission.
Yeah.
Well, PSA is prostate-specific antigen. Yeah, so it's a blood test because the prostate gland produces chemicals, and it's expected that if there's prostate cancer or the prostate is overworking, then it produces a higher level of that antigen. So a blood test will pick up if that PSA is high. Now, why we say it's not a very good test is that if you look at it, always say PSA is a good test to monitor progress. If somebody has a prostate cancer and is being treated, the levels may be high. After treatment, the levels come down. And if the person is followed up every 6 months or thereabout, if the levels remain low, then it means that the treatment is working. If it begins to rise again, then it means that the prostate cancer is becoming active again. So the PSA is excellent for monitoring prostate cancer management. It's not a very good test for making a diagnosis because a few other things, something as simple as a water infection, urinary tract infection, can cause a high PSA. But that's all we have for now, and that's why we say it's better to have it done and have that baseline. You know, some people have like a good test is like if it is negative, then it means you don't have a problem. But with the PSA, sometimes it's negative, but you actually have prostate cancer. Sometimes it's high, you go ahead and have all the investigations, and then they say everything is normal. So it might be high, but you're okay. It might be low, but you're not okay. For majority of people, if you have symptoms and it is high, then it's most likely to be true that you have prostate cancer. Having said that, at least that is all we have now. So have a baseline and then see how life goes on for the future.
Thank you so much. A really comprehensive answer. And I, when you were speaking about it, you married that with people advocating for themselves. So the fact that, you know, it's not something that's done routinely, and we've acknowledged that, but you've also acknowledged that we do see higher rates of prostate cancer amongst Black men. And so it's within your rights to go and say, okay, this is a concern of mine, I would like the blood test. And so I thought that was a really important piece of advice, because that confidence to do that isn't always there.
Yeah, like I said, just to reiterate that I know many GPs, when you can't even get the appointment, but like almost every GP practice has an online system of being in touch. Like some have e-consult, some have patches, some have AcuRx. There are different ways of reaching your doctors, not necessarily by the phone. You know, so go on your practice website to know, you can communicate to say, my name is Abiye Hector-Goma, I'm 46 years old, I'm a Black man in your practice, and I've been told that from age 45, we should be able to request a PSA. Can I request one? And some GPs say, yes, booking with the nurse. They send you a link to booking. But some will say, no, we can't. Go to Prostate Charity website, look at that template letter, write back to your doctors, you know, and this is my right to have it done. Put the link there and make sure you get it done. Don't get fobbed off. Tell them it is your right in the NHS at 45 and above as a Black man to request a PSA. And if you get it done and it's fine, great. At least you've done your baseline.
No, definitely. Thank you. And Another question was, you mentioned about clogged artery walls and a really good depiction, imagery of that. And so someone has asked about what are the best methods to clear clogged artery walls. So if you could just explain that it's not an actual physical procedure, etc.
Okay. So the first and most important way to clear clogged artery walls is a healthy lifestyle. I've seen some patients who you cannot fault them lifestyle-wise. They're doing everything that they need to do. So one is, how physical are you? How much jogging do you do? How much running or walking do you do? How much swimming do you do? Exercise helps. There are two kinds of cholesterol. One is HDL, which is good cholesterol. It's called good cholesterol. One is LDL, which is bad cholesterol. Bad cholesterol, LDL, is what clogs the arteries. HDL mops up the bad cholesterol from the blood vessel. So the higher your HDL is, the better it does at removing bad cholesterol. So one is exercise. Do a lot of jogging if you can. Jog 1 hour a day or 30 minutes of body activity 5 days a week. That's physical activity. That's one. Next one is healthy eating. Fat in the diet can contribute to the arteries being clogged. So making sure that you have a healthy, what they call the so-called Mediterranean diet, a lot more of greens, a lot less of saturated fat in your diet would help. So the two things, making sure your blood sugar is within normal limits, because diabetes causes more cholesterol formation, as well as your blood pressure. But if your blood pressure is high, it irritates the walls of the blood vessels, which makes bad cholesterol stick to it. So having a blood pressure that is normal, making sure that blood sugar is normal, all these lifestyle and health check things will help to reduce it. Then we'll now come on to medication. From point of view of medication, now there's a new evidence-based management for those that have long-term conditions. What we call a Q risk, which is a computerized calculation of your risk of a stroke or heart attack in the next 10 years. When you do a health check, your doctors will check what your Q risk is. If your Q risk is over 10%, it means that your chance of having a stroke or heart attack in the next 10 years is a bit elevated. Then medication is requested. So statins are the drugs that are used to help to clear clogged arteries or to reduce the bad cholesterol level. And with statins, there are 5 other medications. If statins don't work or don't do it satisfactorily, there are 5 other medications. So first lifestyle and then medication to clear. But obviously, if somebody has had a heart attack or has had a stroke, then the vascular surgeons can pass a tube into the blood vessels and then clear the clogged, whatever has blocked that area. That is the final option to clear it off at surgery.
Great, thank you, sir. No, that's fantastic. And I can see that we've got someone's hand up, and I'm just going to come to you in 1 second. Bear with me. It was just a question related to what you just said about managing cholesterol that I wanted to just bring up. So someone has referred to an injection for high cholesterol, and inclisiran, and I didn't know if you'd heard of that. And what were your views? Because they said it's new, so they're anxious.
Okay, yes. Like I said, there are 6 drugs that are used. So the inclisiran is one of the newer ones. And then when it came into, it's been in the market for a few years now. And we were saying in primary care that it should be started in secondary care, but it is given. It's if statins are not satisfactory, and maybe they go on to ezetimibe is not satisfactory, then inclisiran is an option, which is more effective, obviously. And if that has been recommended, it's most likely recommended based on evidence of its potency, which is above that of statins and ezetimibe, which is the first level of treatment. So yes, that's an option. It's one of the 6 medications for reducing plaque as well as cholesterol in the bloodstream.
Perfect. Thank you so much. Incredibly helpful. And so the person who had their hand up, the name was Diagnostics. We lost your hand. If that was my fault, many apologies. But we may have lost your hand. As soon as it comes back up, I'll get you on directly. Oh, you're back up. Perfect. So diagnostics iPhone. Sorry. Please feel free to speak. You can unmute. You're still muted. So if you unmute, that would be great.
Yes.
Lovely.
Good morning. Yes, good morning, everybody, my African and African Caribbean brothers and sisters. Now, Dr. Goma is actually my doctor in Leeds. And I feel I'm privileged to have a black doctor because he is of my... And this is a serious point for me. He is of my image and he understands who I am and my makeup. Now, one of the challenges that I personally face is the attitude of consultants when it comes to black men. I have experienced, consultants talking down to me, and I've had to be very assertive with them just to get what a normal white person would get. And I've spoken to Dr. Goma about this on several occasions, and it is a very big concern for me. I don't know how anybody else feels about my comment.
So first of all, thank you so much for coming on. And it is, I love it. We didn't plant you, so we should say that, disclaimer. But it's wonderful to have someone who's cared for by Dr. Goma right here. And I think, Dr. Goma, I'll let you come in, but I think, first of all, your acknowledgement that, having a black doctor and having someone that you align with, that understands you specifically, is wonderful. And we I'm sure there's many people on the call jealous, but we don't take that lightly at all. And I have to say, just to say in my work, that I think that's why we do things like this, and why many black doctors will come on and take time out of their weekends to come and speak, because not only have we personally experienced it as other black people within healthcare as patients, but also we've witnessed it for other patients and friends, family, and you can witness your colleagues maybe doing that. And so I just want to say that I, hear you. It does happen, and it's, unacceptable. And I think that that's why, CATHIP was put into fruition to say that this needs to change, and we need spaces for people to feel confident. But what I would say, and I know with Dr. Goma, is that in terms of the advocacy, if you ever experience, going from now on, and you experience a negative experience, please do report it. Because it's and if it is in hospitals, when you're saying consultants, there are PALS services within hospitals, because that's why they're there. But often when we'll say that this is an issue, they'll say that it hasn't been reported, and people haven't come to complain about it. So I hear you. You are right, and it is unacceptable, and it needs to change. But we're asking people to also voice it in the hospitals so we can make a difference. But Dr. Goma, please chip in.
All right, thank you very much. I know from the voice, I know who is talking, but I won't mention your name. One of my patients. Yes, it's a real problem. Like there's a saying that if you're not on the table, you're on the menu, and in every aspect of life, whether as a patient, even as a member of staff, if you work in an area that's predominantly Caucasian, unless you are working with people who have a heart of gold, is a challenge. And I know that problems like this exist out there, and that's why I was talking about the PSA, because most GP practices will try to fob you off. But when you know you're right and you stand on it in a nice way as possible, know your rights, and when you know your rights, you stand on the rights. It's always important. It's a long journey. I mean, last night I was a practice due, and everybody in the party, about 25 of us, I was the only Black person, and I'm the head of the organization, which is a lucky thing for me. So I would say, know what your rights are, and if you feel that somebody is trampling on your rights, stand up and speak up for yourself in a nice way as possible. And I know my patient takes no prisoners. You know, he knows his right and he stands for it all the time. And the more people stand for what they think is right for them, and I think the better it will be, because when people have had an experience of trying to fob you off and you stand politely, you stand on what is right, the next time they have one of us, they will behave in a different way. So that's what I can say about that. Stand up for yourself, know what is the right thing, and then stand on it in a nice way as possible.
Thank you so much. And again, thank you for sharing. That's why I love doing Health Hour, because everyone gets involved and we hear different perspectives. So we've got, as always, a number of questions, some related to your talk and some tangentially about what the issue that's just been raised about Black doctors. So I'm going to try and bring everything together. So I'm just going to ask one more question from the medical side. And I think it is really important because you talked about mental health and related stress, and someone's written, can you provide guidance on managing stress for men, or places that they can go to support themselves or others?
Okay, if you Googled stress, I'm sure you'll find quite a bit of information on that. There is one place that I like a lot. It's, if you have a pen, you can write it down. It's web.ntw/NHS/self-help. web.ntw.nhs/self-help. It's an excellent, I think it's Northumberland NHS Trust. They have about 20 self-help guidelines on many conditions. That's always my first go-to place for information about anxiety, stress, depression, name it, panic attack, and all of that. So I recommend that website. Let me just write it down to be sure it's right. Is web.
Yeah, I'm just putting it in the chat for people.
Okay.
I know that website. I love it too. Yeah.
web.ntw.nhs. Yes, web.ntw.nhs.uk/self-help. So that's my first go-to place, web.ntw.nhs.uk/self-help. The next place I would like to recommend is Omnitherapy. I know in Leeds, it's available on the NHS. It's OMNI, Omnitherapy. Omnitherapy. So wherever you are in the UK, there should be an Omnitherapy service. And that's an online kind of computerized advice educational system. So there you find, again, on stress, on anxiety, on depression, and a few other things there. While you're waiting, again, in Leeds, for those in Leeds, we have what is called Leeds Mental Wellbeing Service, Leeds Mental Wellbeing Service. And I'm sure in every other city, there is something like that, which is a comprehensive website looking at what options you have. Well-being, Mindwell, the MINDWELL, Mindwell is again another website which is available all over the country, where you can find, you can be signposted to what kind of support services that are available in your area. So while you look at the online tools to help yourself, you can self-refer, and while waiting to be seen, there will be a wait everywhere. You can practice those self-help strategies. But healthy lifestyle trumps all. Just being more active helps to release endorphins, which make us feel good. So walking, running, swimming, dancing, whatever you can do, just do it. Just keep active, and that would help to boost your endorphins. And I use the support services that are available both online as well as the face-to-face options.
Great. Thank you so much. And Darius, you had your hand up. I know you've written in the chat, but I wondered if you wanted to speak directly. Whilst Darius is coming on, we'll wait for you if you're able to come on. There is a question about related again about the PSA, and someone has said, what about getting an MRI to back up the blood test? So just how do we push about imaging as well as blood tests if we're concerned?
Yes, in terms of in the management of prostate cancer, I think somebody asked in the group about the symptoms.
Yes.
The IPSS score will give you an idea of what symptoms, because IPSS score kind of asks the questions about the symptoms. One is incomplete emptying. When you go and weed, you feel like you've not finished. Incomplete emptying. The other is frequency. Are you finding yourself, you can't wait for 2 hours before you need to go again? And then intermittency, when you're weeing, it doesn't just come as a flow, it kind of start and stop. And then urgency, when you need to go right now, you just can't wait for another 5 minutes. And then how is your stream in the public toilet? Do you have to go very close to the urinal, or you can stay 1 mile away and then shoot it down into it? Do you have to strain? Some people now realize that when they try to strain, they can't wee. When they relax, then the wee comes. So that's another symptom. And then nocturia is how many times do you wake up in the night to wee? So these 7 questions and your answers will now determine what your severity of what you call lower urinary tract symptoms, LUTS. That's what it is. Now, if your PSA is high, we will refer you to the hospital. When we refer you to the hospital, they will examine, do a rectal. We may even do a rectal before we refer you. One of the first things, in terms of the gold standards, one of the first things the urologist will do is to do what is called a parametric MRI scan. It is that scan that will now determine whether you do a biopsy. Before they did a biopsy, but now a parametric MRI scan is first level of management by the urologist before they decide whether you need a biopsy or not. So the MRI scan definitely will come. It will come when your GP has referred you. Your GP will refer you when you've checked yourself and will do a PSA. If your PSA is normal, but you have symptoms, we'll first of all treat. If your PSA is high, we'll probably rule out an infection and refer you. But if we treat, the PSA is normal, if you treat and symptoms are not improving, we'll refer you to urologists, or we'll refer you directly if your PSA is high. And then when they see you, an MRI scan is the first level of management.
Great. Thank you so much. Right. So we have, I love it, loads, thick and fast coming in. I'm going to go to diagnostics and then Hawaii to speak. So diagnostics, if you'd like to speak.
Is it diagnostics for, is it for
prostate? It's the name on the thing. So if you could unmute diagnostics.
Oh, okay, the person,
yes.
Okay.
Yeah, sorry. Diagnostics, yeah.
Hello.
Hi.
Hello.
Hello.
We
Hello,
can
yes.
hear you.
Can
Yeah.
you hear me?
Yes.
Okay, thank you. You mentioned in your response to my contribution about PALS. Now, I've had personal issues with PALS because the members are funded by the NHS. So they advised me to make a formal complaint regarding my situation at the time, and only to find out that the staff of PALS, they work for the NHS. So it was never, what I'm trying to say is that there need to be a completely independent entity for patients to interact with rather than PALS, because I found them not being sincere at all.
No, and thank you so much for that. And there is other organizations like Health Watch that people can look up, and those are independent organizations. And I completely take on board what you say about PALS. what I would urge people to do is to do both, to make sure it's through the NHS system, but also there are external bodies, like you say, like Health Watch, that would be have that independent viewpoint, that you will feel safer and feel that your concerns will be definitely addressed. So thank you, completely take that on board. The reason that I say about speaking through the channels is that often, again, if it's not clear within the channels that there is an issue, then it's easier for people to dismiss it. So that's why I said that. But yeah, completely take what you say on board. Thank you so much. Thank you.
Thank you so much.
And Hawaii, I think I'm saying that right. P30 Pro. You can unmute.
Hello. Good morning.
Hello.
Hello. Yeah.
Hi.
I have asked a question already, saying what is a comprehensive health check? That's number one. It hasn't been answered. I put it on the chat.
Yeah, you were the number 3 to go.
I have 3 questions. And secondly, I suffer from high blood pressure. And recently, my blood pressure has been very high. So I went to see the GP. They've increased my medication, gave me a chart. I went back. They gave me a new medication. And then they also asked me for a blood test, which I've done. The results have come out saying that everything is normal, kidney function, everything is normal. But blood pressure remains high. Now, they said the only thing that is high is my lipid function, but that there is no cause for alarm. So I think that if my fat is high or cholesterol level is high, they should at least tell me this is what it is. They said, oh, it's a little bit raised, but there's no concern for that. So I'm quite worried because my blood pressure hasn't gone down, though I'm meant to go and see a pharmacist maybe next week, just to check how the new blood pressure medication is doing. So I just need an advice on all this. Because the comprehensive health check, like you said, is it only blood tests? Aren't they supposed to do other things like checking my ECG levels and other things? Just blood tests and that's it. So I want to know whether there's more I need to ask them to do for me, please.
Okay. In terms of your blood pressure, we have a stepwise management of high blood pressure. We'll start with A, and then you have 2, then 3, then 4. If you're on 4 blood pressure medicines and blood pressure is not well controlled, then we'll refer you to see a cardiologist or a kidney specialist if there's anything wrong with the kidneys. For 95% of patients, again, there's no cause for hypertension. The blood pressure is high, everything is fine. So it's quite a good thing, in quotes, to be told that everything is normal. It means that your kidneys are fine, your blood sugar is fine, everything is fine. It's just that you have maybe what is called a resistant hypertension. Yes, ECG is part of the management. So if somebody has hypertension, checking the urine for protein, checking for diabetes, doing an ECG is part of the initial workup of hypertension. I don't think we don't routinely do ECG as part of a health check. But if you did a health check and your blood pressure was high, for example, and you're now, there's a process for either you do a 1 week of blood pressure monitoring or a 24-hour blood pressure monitoring. If you are now found to be hypertensive, then ECG and urine for proteins is done just as part of the care. So, but for some people, even though you're doing everything right, the blood pressure is not controlled. So we just keep on increasing the medication until you're able to get it under control. So comprehensive health check, what I mentioned is what the comprehensive health check is: blood pressure, blood tests, then lifestyle advice. And then based on the results will now tell us if it is high blood sugar, we follow up the pathway for diabetes. If it's high blood pressure, follow up the high pathway to now make a formal diagnosis. We don't use one high blood pressure reading. We do a 1 week or do a 24-hour ECG, blood pressure monitoring. And at that point, based on the outcome of the initial health check, further testing will be done. So ECG and urine test is what may be required. But if your blood pressure is still very high, there are additional blood tests that can be organized, or 24-hour urine collection that the hospital may advise for very high blood pressure. So just keep faith and do your lifestyle bit and follow up with your doctors.
Thank you so much, Dr. Goma. So we have very little time and lots of questions, but I'm going to just pick two. So everyone do bear with me, but we've got lots coming through on Facebook, YouTube, and on Zoom. But a recurrent theme that's been coming to some of the questions to me privately as well is about mental health, but I wanted to pick two. And for just kind of very brief answers to them, if possible. So someone has raised the issue of, you mentioned mental health, but also another condition that's affecting many of our communities is about dementia, and not only experiencing dementia, but being a custodian or caring for someone with dementia, or preventative care for dementia. And so was there any advice that you could give towards that, please?
Right, thank you very much. The advice goes back to the beginning. I always like to take things from the foundation. Poverty brings ill health. Because we are Black, we are more likely to have fewer opportunities. So trying to get out of the bottom of the pyramid in terms of making sure your children go to good schools, supporting them and all of that will mean that what we don't have, our children would have. That's the first level. Poverty brings disease. Poverty reduces our lifestyle options. The more money you have, the more healthier food you will eat and stuff like that. So lifestyle is important. In dementia, vascular dementia is years of tiny blockages in the tiny blood vessels in the brain end up causing dementia. It doesn't happen overnight. And that's why we talked about the blocked arteries and the problems that happen. So again, if your parent has dementia, you and the grandchildren, this is the time to prevent dementia for yourselves, improving healthy lifestyle. So that's the key thing. Improve your lifestyle, eat the right food, sleep adequately, try and be happy, go to your dance lessons, all of that. If you're diabetic, take your medicine seriously. If you have high blood pressure, be consistent with lifestyle and medication. These are the building blocks for dementia prevention. Have social networks. Don't keep to yourself. Mix with people. If you have work that is stressful, have to manage stress better and all of that. And then make sure that you access dementia services, because caring for people with dementia is very stressful. There's Alzheimer's Society. Find out what support is available. Again, a lot of times there are services that are available. We don't know about them. Do your research. Find out what's available and access support for your family member. And what I would say about the kind of a whole package of dementia management for the individual, for the family, for the next generation to prevent dementia.
Great. Thank you so much. And the very last question, because we've run over, but we did start a few minutes late, so I'm cognizant of that, is that someone has commented that their husband had a difficult experience with a GP where they felt essentially let down, and felt the GP was really ignorant of their cultural needs. But she's worried about his mental health and says that he feels that he has symptoms that are similar to that of menopause. And just wanted to raise that with you. And I know that there's actually someone else that's written to me personally with a similar scenario. So just your final thoughts on this would be fantastic, please.
Yes, I mean, again, going back to lifestyle, money in the pockets, how are those, what are the financial issues? What are the healthy lifestyle issues? But I think if he feels he has menopause, if he's up to that age, he could ask for GP review and ask for testosterone levels. Sometimes having a testosterone check will give you an idea of what's going on. Making sure that he's had the basic blood test, maybe it's a thyroid function test, a testosterone level check will be a good point. Now, if those ones are normal, then the doctors can say, well, there's no evidence of that. But if testosterone is low, for example, having to see an endocrinologist to change, to be given some testosterone supplement could make a difference for that person.
Perfect. Thank you. Dr. Hector-Goma, what can I say? Thank you so much. A fantastic presentation and fantastic engagement with all the questions. And as ever, to everyone that has been listening, I just want to thank you for all your questions. We don't take it lightly that you come each week, and we don't take it lightly that you engage in the way that you do, because your questions have been fantastic, and we just, as ever, can't get through everything, but I've tried to piece things together. So do please bear with us, and there'll be other opportunities to ask questions in future shows, but really thanking you all. I will now hand over to my colleagues. It'll either be Ruth or Natasha to take us through some announcements, but thank you all, and thank you again, Dr. Hector-Goma.
My pleasure.
Yes, thank you so much, Goma, for sharing such a brilliant presentation with us. Can everybody hear me okay?
Yes, we can.
Oh, fantastic. That's great.
Okay.
So, Natasha, would you be able to share the slides, please? I'm just not sure it worked too well on my side from the way it was before.
Sure, that's absolutely fine. I just wanted to advise all the relevant links. I'm just going to put it on the chat now so I can share the screen just in case anyone needs it. Perfect.
Yes, so thank you so much again, Dr. Goma, for a brilliant session. It was our latest edition of Healthy Hearts, which is our session that focuses on diet and physical activity. So we hope that some of you will be able to join us for that on Tuesday evening at 6:30 p.m. Please. And we will be sharing the exact topic of that a little bit later, and we hope the 16th session. Thank you, Natasha. Could we have the next slide, please? Great. So we are for advocacy.
Ruth, I don't know if it's everyone else, but I think the sound is a bit static. It's coming through in bits. I don't know if that's the same for everyone else, but I just wanted to note that just in case people thought that it was.
Yeah, we're having a connection issues. That's why I can't hear you, Ruth, sometimes when you're asking for the next slide.
Sasha, would you like to continue then?
Yeah, maybe just, maybe it's better. Apologies for that. As you can see, Ruth really tried to make the presentation, just having a connection issues. So this slide is really just about a current crowdfunding campaign that we have. We're really trying to support CAN advocacy service. At the moment, we have had 37 supporters, but our goal is to get to £20,000. So every little counts. So if you'd like to support us, there is a series of services that the advocacy team provides, from help with people that have legal issues with documentation, housing issues, domestic violence victims. They help parents that might be facing any difficulties and challenges. They help a lot of people in the community, and the requests cannot be enough. They keep coming. So if you would like to support us, there is a link on the chat and QR code as well on the screen. As I said, they do provide guidance for parents. So at the moment, they have a course that's going to start in January about stronger relationships for parents and guardians, of course, to learn how to manage anger, stress, discipline strategies, and other ways to better look after our children. So yeah, the link is on the chat and also QR code on the screen for all of the slides. And we having our last event of the year is a Christmas Pampering Day, really focusing on moms, Black moms and their children. There will be activities for both children and moms. So do come along. That is, as I said again, the link is on the chat as well as the QR code is on the 16th of December. Places are limited, so do register. So in Stockport, we're calling all Stockport residents for our Green and Art service. We have, you will get to experience painting, textiles, maneuvering clay, and the arts are for everybody. Make time. It's really important for your well-being, for, socializing as well. We have Michelle, which is a great service manager, very accessible. Her contact is on the chat as well as her email address and phone number. Last but not least, a very important thing that CAN provides is Black-led counseling services. We spoke about stress here. We spoke about mental health. Black men's mental health is a priority for us. So if you want to access our services, there's a link on the chat as well as an email address if you need any further, clarifications. But as you can see, we help with an array of subjects. We can also signpost people, but really, really, we are here to support you. And CAN does, host the sessions, but as mentioned before by our great host, we do have partners such as the Enfield Caribbean Association, Rafa International Development Agency, the Royal Assembly Redeemed Christian Church of God in Sheffield, Croydon BME Forum, and BHI. All of their contacts are available if you reach out to us on the emails I've left in the chat. So we don't take your you joining us for granted. Thank you so much. Thank you, Dr. Hector. Thank you, Dr. Vanessa. Thank you, Ruth, as well. And we hope to see you next week.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.